Hey everybody, today I was asked, can chiropractors treat tennis elbow? The answer, of course, is yes, provided, well, in many different ways. So we'll go over that in a moment. The first thing we want to look at is who does actually get tennis elbow. Tennis elbow can happen to people who are at any age doing any activity. You don't have to be a tennis player. It is, in fact, a location-based diagnosis. So it has nothing to do really with the specific symptom. It's what we might call, it's more of a symptom itself. If you have pain in the outside of your elbow, so that's the lateral elbow. If you stand facing me with your thumb pointed outward and it's on the outside of the elbow here, that would be called, perhaps you might call it lateral epicondylitis near the lateral epicondyle of the elbow. And that would mean tennis elbow. If it's on the inside, it would be golfer's elbow. But there are a number of specific diagnoses that fall under that category of tennis elbow. So we might say to you that you have tennis elbow. It's a very convenient diagnosis. It's easy to remember, but it really doesn't exactly explain what's going on with you. And it can be a number of different, any one of or many individual things happening. We used to call this, I used to call this a garbage can diagnosis, and not in a negative way. It's just that you could fit any number of issues. In the chart, you wouldn't write tennis elbow. You would write down the specific problem. I'll go over some potential things in a moment. Lately, you would put all of those diagnoses in the garbage can. You would take them away and get rid of them. So that was kind of the idea. But really, you didn't have to explain what all the garbage was because nobody's going to understand you. The patient's not going to understand you. But when you say tennis elbow, yeah, it hurts right here. I've got tennis elbow. That is a good way to communicate sometimes. It's a better way. What I prefer to say is it's a low resolution diagnosis where many structures can be effective or any one of them. When we look at the actual elbow, there are many things that could be related. It could be the tricep muscle or the bicep muscle, which we can't see right on this diagram. But then the elbow joint itself has the capitellum here, where the radius actually articulates against it, and then the ulna articulates against this part of the joint, which is called the trochlea. And all of this needs to move smoothly, or we could start to get irritation around in the ligaments and tendons around that area. So there's a lot going on with the anatomy. In terms of the muscles, so it could be the brachioradialis. Brachioradialis, the nerves begin at C5-6. So the nerves that actually control that actually start up at the spine at C5-6. This right here is the extensor carpi radialis longus. Again, that's C6 and C7. Then here's the extensor carpi radialis brevis, which is C6 and C7. Then the extensor digitorum, the extensor carpi ulnaris, extensor digiti minimi, and the anconeus. So all of these muscles are in that vicinity. We could go a little deeper. So if we hide these, now we have the supinator muscle. So again, that's at C6. All of these, if we look here, you can see these nerves. If we hide these muscles, we can see all these nerves. We could trace all these nerves back up to the spine. So any place around C5, 6, 7, all these nerves actually come out, and we see here this brachial plexus. These nerves actually come down around and into the shoulder, underneath the shoulder blade, into the underarm, and go down into the arm. So we can see how the spine has a lot to do with problems in the arm, or it can have a lot to do with problems in the arm or any place in the body for that matter. When we look exactly at what can happen here, typically, we used to think that it was inflammation, that was really what was causing tennis elbow. That was back in the 90s. I would say maybe about 15 years ago, they started thinking that it was more micro tears or scar tissue that was causing the issue. So what will happen is when you damage your arm, either because of a repetitive strain, your body heals itself and it forms scar tissue, which doesn't form very smoothly. It actually makes knots in the muscle. And those knots create friction in between the muscles. So those muscles that I just showed you that are all running next to each other, you could actually get scar tissue that's in between, even underneath the muscle. You can get scar tissue even in the joint. Between really any moving structure in the body, you can actually get this scar tissue kind of gumming it up, and it gets hard and it starts to cause friction, and this is really where most of the pain comes from. And there are different mechanisms causing scar tissue. It could be sharp tension, so from a repetitive strain or an injury or something that you've done. Hypoxia, so if there's not enough oxygen getting into that muscle, it will start to cause scar tissue. Your body's just not going to finish the healing process properly, and then scar tissue starts to form. It could be a contusion, so if you bang your leg, you get like a, what we might have called a Charlie horse, a bruise in your elbow. Then when it heals, it can create scar tissue. And it also takes time to create scar tissue. So the texture of the muscle, when it's hard like that, that doesn't happen overnight. That's not an injury that's 3 days old, a month old. That's usually at least 3 to 6 months old, probably years old. We'll often describe the texture as something like ropey, knotted or ropey. If it's more throughout the muscle, if it's older, usually we'll start to call it leathery. So all of these things are just describing the texture of the muscle that changes over time, and typically those muscles aren't going to be as elastic, they're not going to move as smoothly, and you're going to get more pain occurring, and they're also not going to be as strong. You might think hard muscles are stronger, but usually hard muscles have more scar tissue in them, and they tend to be less elastic, which really, it's that elasticity of the muscle that gives it its strength, isn't it? That is the function of the muscle, is to change length and to be elastic. So the classic treatments, oftentimes I'll see somebody come in with an armband or some type of a brace. Those can feel soothing. It could even protect your arm and give you a little bit more awareness, but it can also decrease the oxygen, and it can create more hypoxia and make the scar tissue get worse over time. So I'm not a big fan. Same with taping, depending on the type of tape. If you're using kinesio tape, that actually improves the circulation if you put it on properly, but if you were wrapping it tightly, people don't usually do that with your elbow, but if you were wrapping your elbow tightly, then that could be a problem. Other treatments, things like ultrasound and shockwave, which are very similar, what they will do is give a microscopic massage to the whole area. Typically, it's not as specific. They're not directing it toward the exact structure. They're just you can just do that where it hurts, similar to what we would do with the laser therapy, although it's a completely different mechanism. Ultrasound and shockwave are actually going to give a microscopic massage to try and break apart that scar tissue. And TENS and STIM, the purpose of those would be really to block the pain, but that really isn't solving a problem. It's really just blocking the pain, which some people really want. I don't do any of those treatments in my office. What I'm in favor of is a treatment called active release technique. So this is a type of specialized massage technique, I guess is a good way to, it's a soft tissue technique where I actually isolate the specific structures that have a problem, and I separate those muscles and ligaments so that they move more fluidly. So although that scar tissue actually can't disappear immediately, what we can do is separate the structures so that they move more fluidly, and the muscles, the ligaments can have a smooth motion, and that sometimes can reduce the pain immediately. Over time, it can improve the texture, but this takes a very long time to happen. ART is one of those things that it's a technique. There are hundreds and hundreds of techniques. It's often copied. People say things like myofascial release or MRT or what's another one? I guess that's it. People use different techniques that sound similar to it, but active release techniques is something that we need to get certified in every year. It's been a little tricky with COVID, but we need to get certified every single year to do it. So I've had almost every certification in active release techniques, and I can tell you from copying ART for a few years at the beginning of my practice 16, 17 years ago, compared to now. I think I was, 2 or 3 years in practice sort of copying it. Compared to actually doing it is a world of difference. It is on a completely different level. You always learn something. I always learn something when I actually do the courses and become certified. And even when I recertify and do the courses again, it is so involved with the anatomy, and every single muscle in the body and every single structure has a specific protocol to accomplish something where it interfaces with the other muscles to smooth the motion. It is one of those things that it's no wonder why the results are so much better when you get active release techniques compared to other types of care. Graston technique is a little bit different. This is actually an instrument-assisted massage technique. So I'll actually take an instrument, a stainless steel instrument, and actually use it to massage into the muscles. And the instruments are actually kind of like a stethoscope. I'm just going to get one. Hold on. Almost back. Okay. So these are massage instruments. This one is called a scanner. And actually you can use these. They're not sharp. It might look sharp, but it's actually quite dull, but it's got a beveled edge. And we can use these to massage into the muscles. And here's another one. Call this one a can opener. So you can use actually the different angles of it to massage into different muscles. And this actually works not just for massaging, but it's like a stethoscope. And because scar tissue is hard, when you rub the instrument into the muscles, you can actually feel the scar tissue. It almost feels like gravel, but you can actually feel deeper into the muscle with this than you can just with your fingertips. So applying a little bit of lubricant in the elbow, we're able to work on these different muscles, go a little bit deeper if we need to, or I can use any instrument. There are a bunch of instruments to go around into the anatomy and actually massage into it. So that's what Graston technique is. But as I was mentioning before, I don't want you to underestimate how important it is for the nerves going down into the muscles to be working properly. If those aren't working properly, it really changes the behavior and the coordination of the muscles. So the adjustment at the spine, if you do have a subluxation or a problem in the peripheral nerve, it's incredibly important to check the spine and the nerves going down all the way into the arm to make sure it's functioning properly. And that's how I take care of tennis elbow, and I hope you found that interesting. Bye.